Placebo power. It's not merely sugar pills. Introduction. Placebos, often caricatured as inert, nothing pills that magically trigger healing, are far more than sugar and bluff. Decades of research reveal that placebo responses engage real neurobiological mechanisms and sometimes outperform sham treatments or no treatment controls under specific conditions. To appreciate the genuine power of placebos, we must explore 1. The brain and body pathways they recruit. 2. The surprising efficacy of open-label placebo protocols. And 3. Paradoxical instances in which abstaining from any intervention outshines sham procedure. 1. Neurobiological pathways. Biology behind the bluff, far from mere imagination. Placebo effects harness well-defined neural and physiological systems. Administration of a placebo painkiller elevates endorphin levels in key brain regions, e.g., the anterior cingulate and insula. Neuroimaging shows that placebo analgesia activates the same descending pain inhibition pathways as morphine and is partially reversed by the opioid antagonist naloxone, demonstrating genuine biochemical engagement. Dopaminergic reward circuits in Parkinson's disease. Functional PET scans reveal increased dopamine release in the striatum. This dopaminergic surge transiently ameliorates motor symptoms, underscoring that expectancy alone can mobilize neurotransmitter systems. Immune and hormonal modulation. Placebo interventions can alter immune markers, such as reducing pro-inflammatory cytokine or shift stress hormone levels, e.g., cortisol conditioning paradigms, where an inert pill consistently follows. These neurobiological findings confirm that placebos initiate bona fide biological cascades. Open-label placebos' transparency that still heals conventional wisdom holds that deception is essential for placebo efficacy. But open-label designs challenge this assumption. Clinical trials in IBS and depression, in randomized studies of irritable bowel syndrome and mild depression, patients knowingly taking a placebo in bottles labeled placebo pills. The key ingredients appear to be a supportive provider relationship, clear explanation of placebo mechanisms of honest expectation, even when patients understand the inert nature of the treatment. Framing it as a catalyst for physiological self-regulation creates an expectancy framework. This reframing activates top-down cognitive processes, such as attention to bodily changes and positive reinterpretation, that amplify normal healing processes. Ethical advantages. Open-label protocols avoid deception, enhancing patient autonomy and trust. They open new therapeutic avenues. Open-label placebos thus demonstrate that conscious belief and therapeutic context, not secrecy, drive much of the placebo response. 3. When no treatment outperforms sham, the reverse placebo puzzle. Surprisingly, it is not always true that sham interventions beat doing nothing. Sham surgery trials in some orthopedic and cardiac trial, comparing real surgery to sham operations, incisions without actual repair. Both groups often improve equally, but neither outperforms patients receiving optimized medical management without any surgical ritual. The physical risks and stress of sham procedures. Negative placebo effects. Nocebo. Conversely, sham treatments may sometimes trigger adverse expectations. Participants told about possible side effects of a sham drug report those very symptoms. Therapeutic ritual versus risk trade-off. When the act of providing a placebo involves invasive or burdensome rituals, stress, infection risks. Under these conditions, refraining from intervention can be the wisest course. These paradoxes highlight that placebo responses depend not only on expectation, but also on the balance of ritual benefit versus procedural cost. Conclusion: far from being mere sugar pills, and are subject to complex trade-offs when compared to no treatment or sham procedures. Recognizing the genuine mechanisms and boundary conditions of placebo power invites us to integrate ethical placebo-based strategies. Whether through honest patient education, conditioning paradigms, or careful evaluation of when less may indeed be more. In doing so, we honor both the science and the human experience.